HIV and AIDS continues to be a major public health issue in the United States, and it overly affects Black communities when compared to other races. According to the Kaiser Family Foundation, the HIV diagnosis rates for Black individuals was approximately 8 times higher than that for white individuals, highlighting a significant racial health disparity. This inequity is due to the combination of social determinants of health, such as limited access to care, stigma, poverty, and systemic racism. Addressing this issue is critical not only for improving individual outcomes, but also for reducing the overall burden of HIV nationwide. This discussion will explore the impact of this disparity, current initiatives in place to address it, and evidence based strategies for change. According to the CDC, Black Americans have the highest rates of HIV prevalence among all racial ethnic groups. This makes up 44%, which is nearly half of all people living with HIV in the US. These disparities lead to significant challenges in healthcare delivery, including delayed diagnosis due to limited access to regular health screenings, which can result in later stage HIV diagnosis, which complicates treatment and increases transmission risk. Treatment gaps. Black individuals with HIV are less likely to be linked to care and achieve viral suppression compared to their white counterparts. Higher mortality rates. Disparities in care contribute to increased HIV related mortality rates among Black Americans. Addressing these disparities requires comprehensive evidence based approaches, such as community based intervention, which would focus on education, prevention, and treatment programs that these types of minority communities need. These could enhance engagement, lead to early detection, and treatment compliance. Providers also play a big role in this and need to be culturally competent and able to deliver cultural sensitive services. This can improve patient trust and adherence to treatment. According to the CDC, in 2021, approximately 19.5% of Black Americans lived below the poverty line, compared to 8.2% of white Americans. This then follows with limited access to health care, lack of awareness due to lower rates of HIV testing and prevention services. Another focus should be on stigma reduction. An article from the National Library of Science focuses on intervention mechanisms that included information and education, participatory skill building training, counseling and support groups, and contact. The primary objective of the intervention, called to provide African Americans, specifically women living with HIV, the tools to handle intersectional stigmas associated with HIV, race, and gender. The study examined the effect of the Unity Workshop on HIV-related stigma among African American women living with HIV when compared to a breast cancer group. The goals of the interventions like this are to provide peer support and accurate education and information, and we need to normalize testing and prevention. We could start by making HIV testing a routine part of healthcare, not something only at-risk people get. There are some strategies and initiatives already in place, such as ending the HIV epidemic in the US. This was launched in 2019, targeting 50 local jurisdictions with the highest burden of HIV, including many areas with large Black populations. It aimed to reduce new HIV infections in the US by scaling up 4 science-based strategies, which are diagnose, treat, prevent, and respond. The initiative has yielded important reductions in HIV transmission. The Ryan White HIV/AIDS program provides medical care and support services for low-income individuals with HIV, many of whom are Black. And then the Office of Minority Health develops policies and programs to eliminate health disparities, including targeted HIV education and prevention campaigns. In conclusion, the HIV and AIDS epidemic continues to have a disproportionate impact on Black Americans, driven by social, economic, and structural barriers. To reduce these disparities, public health professionals and nurses can increase access to routine HIV testing in Black communities, promote pre-exposure and post-exposure education for HIV prevention, provide culturally competent care, and support community outreach programs and peer-led interventions. Thank you.